Sorry guys, I got cut off on my last video. So by the way, in this book, the ones you see I put a star next to, those are the ones that NCLEX tends to ask about the most. So if you can't memorize all of these, make sure you memorize the ones I have a star next to. Anyway, I got cut off, but what I was saying was, so if a patient is, I'm sorry guys, I've been sick and I'm just now catching my equilibrium. What was I saying? Oh, if a patient has hypothyroidism, that means the calcium is low in the blood. So where's it going to be high? It's going to be in the bones, right? So the patient's going to have bone deformities because all that calcium clumping up in the bone. They're going to have bone pain and all that good stuff. If the patient has hyperparathyroid, we're talking about parathyroids, that means the calcium's high in the blood. It's going to be low where? In the bone, at risk for fractures. Important things for you guys to know. Hypoparathyroidism, which is hypocalcemia, those signs and symptoms of hypocalcemia. Remember, the patient's going to have nerve and muscle irritation, and it may manifest as what? Tetany, right? So patient can have Chos-Tex. Remember, Chos-Tex starts with a C, so does the cheek. When you run your finger across the cheek, they'll go like that, right? That's the Chos-Tex. Or the Trousseaus, when you take their blood pressure and the cuff is squeezing and you see their, hands start to do like that. That's a type of tetany that's called Trousseaus. Those are signs and symptoms of hypocalcemia, which is hypocalcemia that is caused by hypoparathyroidism. You got to know that. And if the patient has hyperparathyroidism, which will cause them to have hypercalcemia, all of that calcium running in that blood, what do you think is going to happen? That calcium is going to start to clump up in the blood. What do you think as it's going through the bloodstream and gets to kidneys? What do you think is going to happen? It's going to clump up and cause the patient to have what? Kidney stones. What type of kidney stones? Calcium. That's what those stones are made up of. What else happens when a patient has too much calcium in the blood? They have muscle weakness. The very opposite of when the calcium's too low, right? So guys, this table needs to be your best friend if you're trying to understand hyper and hypoparathyroidism, which will cause hyper and hypocalcium, okay? Calcemia. I hope this was helpful to you. Don't forget the stars. You're going to see it on NCLEX most likely.